Hi, I'm Camilla. I'm a hypnotherapist based here in between Chalfont St Peter and Jarrows Cross. As well as working with adults, I also work with children. Before I was a hypnotherapist, I was a teacher for 21 years, in fact, and I really like children. But what I found was that a huge part of my job became the mental well-being and pastoral care side of my role, and actually that was the side where I got the most satisfaction, and it was that actually inspired me to think outside the box about what I wanted to do for the rest of my career, and that was what led me slowly to becoming a hypnotherapist. So I do see children here in my therapy room. Not all hypnotherapists work with children. I find it really enjoyable. If your child was to come for hypnotherapy with me, we would do some things to get them settled first of all. So it might be that we would have some small toys to play with depending on their age, some books to look at and that sort of thing, and we'll chat about things that they like, and I will generally get them to feel relaxed. And then I will ask them about the issue that it is that they've come to see me about. Children are usually very matter of fact about their feelings, their emotions and things that are going on for them. So they're usually quite happy once they've settled in to tell me exactly what's going on. The kind of things that I help children with include things like anxiety, some phobias, some behavioural issues, maybe some issues with concentration, picky eating, bedwetting can be helped depending on whether it's a medical issue, and really just so many more. It's fun for children, so we will play a bit, we'll talk a bit, and then we will come to the hypnotherapy part. It will depend a bit on how much chatting and other things we've done, but the hypnotherapy part for children is very much like listening to a story or maybe daydreaming, depending a bit on their age. I might include some CBT techniques with your children where I will talk to them about their feelings and their emotions and their thoughts and their behaviour and how those are all interlinked. And it's very interesting when you talk to children who are maybe having trouble with feeling angry about how they describe that they get hot, and those sorts of things can be really helpful in working out ways to help them manage their behaviour. I might also use some NLP techniques, so anchoring or giving them a superpower is one of the things that I might do, which would be where we would remember some really positive times and use those emotions to try and transfer those to the target situation, the situation where they're struggling. And these types of new skills that they learn are then embedded in the hypnosis. The hypnosis will pretty much take the form of a story, depending a little bit on the age of your child, and you'll have a recording that they can listen to afterwards. We might do some drawing. Often in hypnosis, I'll ask them to visualise something, maybe like a magical mirror where they can see the best version of themselves, the version that they want to be. And then afterwards we might draw the mirror, draw the lovely frame, that kind of thing, to try and really get them to think about what they're experiencing. I've worked with children from 6 years up. I have teenagers here too. For them, obviously, I'm not getting the toys out. It's very much tailored to what your child needs, and I would love to have a Zoom or a phone chat about your child and the kind of help that you're looking for them, and see if we can work together to help them feel more positive.